Hi everyone, this is Dr. Stefan. In this video I'd like to answer another question about inhalers and nebulizers. So this is the question right here. So what about using a nebulizer if the inhalers can't be properly used? So this is a very common question that many patients who struggle with lung conditions have. The reason for that is that some of these inhalers, and I'll show you a couple of them, it can be a struggle for patients to use them, and I know that. However, with proper training, most patients can use these very, very well. So I'd like to stress that. So don't have these negative things in your mind, these negative thoughts and beliefs that you won't be able to use an inhaler correctly. I think most people are able to use them correctly if someone really guides them through it. And I have several videos on this channel in which I hopefully show you that the technique is not that bad. Now, if you're still struggling, that can happen and that's okay. You shouldn't feel guilty. Some of these devices are very, very difficult for some people to use. So for example, I would imagine someone who has arthritis, someone who cannot really synchronize their breathing with the triggering of the inhaler, someone who is struggling with some of these things, with other issues. Of course, they may struggle to use some of the inhalers. The good news is that first of all, you've got loads of inhalers on the market which are available. There are so many right now. So if you talk to your healthcare professional, to your doctor, I'm pretty sure you can find one that you can at least use well enough. Because the second step would be, if you cannot use the inhaler, is to try to use something that helps you use the inhaler, which is usually a spacer device. So this is something that I highly recommend that most patients who suffer with asthma, for example, or even COPD sometimes, have around the house. Keep it clean and use it, especially if you've got puffers like the Ventolin, like the blue inhaler, some of the other inhalers that look similar in a similar way. So this is, for example, a Fostair inhaler, but you can have others that look the same. These are inhalers that contain a sort of a pressurized container inside it. And this one, actually, when you put it inside this holder and you press on it, it triggers a sort of a mist, as you can see in this image. And basically, what you're trying to inhale is that mist to catch it as it moves. And you can see it moves quite fast, right? So some patients really struggle to press on the device and really synchronize their breathing to actually get that in. It can happen. Most people can take it with good technique without a problem. But these things help because you can connect one of these inhalers to the end. So I'll show you right now. So if you put it at the end here in the spacer, and then if you press on it, that sort of mist is released inside. I'm not sure if you'll be able to see this, but well, I don't know if you saw it, but basically it's inside here. So now you can breathe out, hold, and release. And you've probably inhaled most of the small particles that have been floating inside this chamber. So this usually helps a lot with technique. So normally a spacer device allows you to remove one of these steps, the step in which you need to synchronize triggering the device with inhalation. Now, how you would do it without the spacer is a little bit more tricky. So for example, I would just demonstrate with this Ventolin inhaler. So if you breathe out, you have to breathe out, and as you're starting to breathe back in, you press on this and continue to slowly inhale. So I'll just demonstrate it once. So you see that it's not that hard, but it can be a little bit tricky for some people. So let's do that. So I'm breathing out. And slowly release. So try to hold your breath for 10 seconds. But what I've done there is basically as I was starting to inhale back in, I just pressed on the device. It triggered, and I just inhaled most of that mist inside my lungs, held it for a couple of seconds, and slowly released. So that's normally how you would use this without the spacer. I've showed you with the spacer, I've showed you this way. Now, the problem is some people cannot use either the spacer because they are on, for example, not one of these pressurized container inhalers, but maybe they're using some sort of a powder, dry powder inhaler, which you really need to produce quite a lot of flow of air to inhale the powder from the medication from these little things. So there are a number of these inhalers on the market that contain dry powder, and actually the dry powder inhalers usually contain a combination of medications that can be very useful for the treatment of many respiratory conditions, and you may not be able to get that exact combination in a pressurized container just because of the pharmacology of those medications. So for these ones, there are no spacers available. Unfortunately, the nebulizers cannot fully replace these. So this is where I'm coming to the nebulizer. The nebulizer is very useful for attacks, for example, asthma attacks that are quite severe and you need a high dose of inhaled medication to be given to you. That's when they help a lot. Sometimes some patients can use some of the medication found in some of these other inhalers as a nebulizer, but usually the options available are much, much fewer. So we have a much larger palette of dry powder inhalers and combination inhalers that can actually deliver several medications at once than we can do with the help of a nebulizer. I would say the nebulizer is a very, very extreme situation when you really, really can't use absolutely anything. But I would say before you get to that stage, try to talk to your healthcare provider if there is one of these multitude of inhalers that can work in your case, because unfortunately the nebulizers do not replace all the medications that can be contained in some of these inhalers. So some of these contain triple therapy. So that means that you would have 3 types of medication in one inhaler. In that single administration of that powder, you're getting 3 medications that control your lung disease. So that helps a lot, of course, if you have severe lung disease, severe airways disease. But you can't really get the same with a nebulizer. And with the nebulizer, you also tend to get a much higher dose of medication. So there's a lot of things that are not fully compatible between nebulizers and inhalers. Now, in between, like I mentioned, there is the spacer. So I would highly recommend that you have something like this around the house, because actually, if you need relief from an asthma attack, for example, and you can't really synchronize your breathing with the Ventolin, with the blue inhaler at the time because you're really breathless and you can't really breathe properly because of the asthma attack, having one of these to just puff inside it and then inhale the puff on the other end slowly as you can, that can help a lot. So this combination may actually be almost as effective as a nebulizer. So that's what I wanted to mention in this video. Unfortunately, for this question, can you replace all the inhalers with nebulizers? Unfortunately not at this time. So it's really important to try to work on your inhaler technique. If you've been diagnosed with a respiratory condition, whichever that is, asthma, COPD, something else, and you're on inhalers, I would say the main thing you need to do is try to focus on getting the right inhaler technique. You can watch videos online, you can talk to your doctor, you can try to check with your doctor every time you go to a consultation. Bring your inhaler with you and take one dose in front of your doctor or your healthcare provider to make sure that you're using the right technique. It's a very common thing to not have the right inhaler technique. It's not your fault. It's not something that you will automatically learn. If you're struggling, ask for help. It's fine. Many people struggle, but once they get the technique right, their conditions really improve because they're actually getting the medication where they need to get it, deep inside the lungs where it needs to go. Hopefully this was helpful, and I'll see you in future videos. All the best. Good health.